Hey guys, Lindquist in the trenches out doing mobile, and episode happened yesterday that brings to the forefront again a scenario that we're faced with as mentors and educators of clinical sonography, and I want to bring it out there and address it. And I think it's easy to forget how important it is to stand up for yourself in certain situations. And machine selection is one of them, right? And so, in the end, on any case that you have the probe on an animal, it is your head on the block. It is your head on the chopping block. Because if something goes wrong, if you miss a lesion, if something gets misdiagnosed, who does it come back to? It comes back to you. You have to fight for your right to party, to bring up an old song from my high school, right? You have to fight for your right to get the best machine for you, and the machine that your eye likes, the machine that gives you consistent results, the machine that keeps you away from long phone calls and back and forth and phone tag with tech support. That's a big time-sucking frustration. You shouldn't have to do that, and you have to fight for your right, because it's not like it was when I was coming up. I sound like one of those old guys. When I was coming up back in my day, when I walked through the snow, it was the doctor, practitioner, owner, almost all the time. If I was a sonographer, I'd have one conversation with the owner, say, hey, we need this machine because this is what we're going to do with it. This is what the RI is going to be, and these are my targets, and this is why we have to do it. It was pretty straightforward and simple. But nowadays, more times than not, the sonographer, if you don't own the practice, which, it happens more and more and more, you don't make the decisions. And therefore, who do you have to ask? You have to talk to your office manager. Does the office manager scan? No, the office manager doesn't scan. The office manager is counting the numbers, is looking at the ROI, is dealing with the relationships with the distributor companies and the coalesced corporations that happen to sell ultrasounds, and so they're dealing from that standpoint. But in the end, if something goes wrong, it's the sonographer's fault. And so why put yourself in a sub-optimized position? You get a budget, the office manager, and maybe it's not the office manager. Maybe the office manager is the liaison, is the bridge to where the real decision is made. Maybe it's a regional manager. Maybe the regional manager has to go up for it. It's like, no, that's against policy. You have to buy this machine from this company. And it's like, I don't want that machine from that company because I can't produce results. Because in the end, you, in the trenches, probe on the animal, has to fight for your right to get solid, consistent results and make your life easy. Fight for your right to do what you went through veterinary medicine for. And this is part of it. When you're a clinical sonographer, it starts with the machine. You need acoustic penetration. You need to be able to diagnose and find resolutions at 8 to 10, 12 centimeters without a problem. If you're not doing that with the machine you're trying, move on. Move on. You're going to miss lesions. It's just physics, right? It's just physics. You have to have a machine that is clean and consistent and doesn't have glitchy software, and it can telemed out with a press of the button efficiently. You should have knobology that you get through the case really fast, because knobology will suck up your day. These are the things you need in a machine. You need a machine that, if you're dealing with mobile, you need the best of mobile. If you can do a standalone machine, try multiple. Make the company send you the machine to where you can try it for a week and you run it through every animal and human being in that hospital, so it's going to be consistent for you. Telemed out a case, test it out, scan the difficult patients, that tense Labrador with the back pain, image that guy, image the pancake cat, put the Doppler on a 230 heart rate on a cat, and then do the same on a 120-pound Mastiff. Make sure it is going to sing for you when you tee it up and you're ready to scan. In all of those situations. Now, if you don't do your homework, it's on you and you miss a lesion. Do your homework, guys. Spend the time. Do your homework. You're investing in yourself, because in the end, it's your reputation. So, when the office manager says, no, you have to buy this machine, My favorite word is no. Are you going to scan with that machine? No. You're not going to scan. I have to scan with it. Therefore, I need a machine that I can work with, that I can produce results for the other veterinarians and my cases in the hospital. That is your response. Because if you don't do that, if you don't fight for yourself, whether you're a tech sonographer, a doctor sonographer, a specialist sonographer, and you're not paying the money, you got to fight for it. Because in the end, the difference in 10 grand, 15 grand on a machine goes away in a week and a half, 2 weeks in a busy practice. It's innocuous, the difference. So fight for the acoustic power, fight for the clean workflow, and fight for your right to party. Because in the end, it's on you. When you get great results, it's on you. You get bad results and somebody else finds a lesion that you missed, it's also on you. So optimize your ability to get the images that you want consistently and within 15 minutes or less on every case. And enjoy yourself. Because in the end, if we're not enjoying what we're doing, what's the use, right? Life's difficult if you're not enjoying what you're doing. And it starts with the machine, and then it depends on you to acquire technique and perfect that technique and optimize that machine and know that machine like it's your kidney, because it filters out a lot of optimal images or suboptimal images or missed lesions. It's just your choice. And you got to stand up for yourself in today's environment. So that's my advice, guys. 30 years doing this. Fight for your right to party. And if we can help you, we're here, SonoPath.com. We do everything around the probe and more. Hope you check in. And, say hi to Sparky. Hey, Sparky. He's my mobile companion. Have a great day, guys. Keep that probe moving. If it's sick, it needs a probe.